back to the channel. I am so excited to have with us today Dr. Saloni Sharma. She is a dual board certified physician in physical medicine and rehabilitation and pain management. She is currently a fellow in Dr. Andrew Weil's Integrative Medicine Fellowship, and she is the author of that book she has behind her, The Pain Solution, which is 5 steps to relieve back pain, muscle pain, and joint pain without the use of medications. And I know relieve and prevent, so I might have screwed that up just a little bit. Dr. Andrew Weil has also written a foreword in that book, and it's full of really great information that we will be discussing today. And before I hand over the baton to Dr. Sharma, I did want to say as a disclaimer that our conversation today is to be used as educational purposes only. If you are experiencing pain, please seek help from a medical trained physician. So, Dr. Sharma, I would love to hear more about you, what's gotten you interested in pain, and specifically what's gotten you interested in the use of non-medication modalities.
Sure. First of all, thank you for having me. I'm really excited to be here. And it's so neat that we share some of the same communities and interests. So I think this will be a fabulous conversation. Really, to get started, I started out, like you mentioned, in physical medicine rehabilitation. That was my residency training, and that is to help people function, sometimes after a stroke, sometimes after a brain injury, and sometimes with pain issues. And so it's all about quality of life. And so that sort of started me on this path. Then I did a pain fellowship. And coming out of that, you kind of realize that there's not that many choices. There's not so many tools to offer people with pain, especially chronic pain and sometimes subacute and even acute pain. There's not as many, let's say, lower risk or whole body treatments that we learn about in traditional training. After that, I sought out some acupuncture training, just to again have a kind of like whole body approach, something that's less invasive and lower risk. And then more recently, like you mentioned, I'm taking part in the Integrative Fellowship through Andrew Weil. And that's really been a nice way to have like a whole body perspective. So I think I sort of got into this path because it was like, there's something more we need to be able to offer our patients. We need to have more tools that look at the whole person and not just, their back or their neck or their knee, but really see, well, what other factors are influencing their pain and their function.
Thank you so much for sharing that. And I'm just thinking, my first formal training is in dentistry,
Mm.
and we often prescribe, when I was in dental training, we prescribed opioids quite routinely. We didn't have all this information that was out about the really dire side effects, including death from opioids. And so in dentistry, there was huge change in the way that we prescribe medications for dental extractions. However, I did some research with the orthopedic surgery team, and they enlightened me to this idea that in orthopedics, they were being evaluated on the pain score and making sure that people weren't experiencing pain, which increased the use of opioids. And I understand from what you wrote about that this is something that you have really focused on. And can you explain myths with use of opioids or pain for orthopedic surgery or orthopedics?
Sure. And yeah, I know you're actually very well versed on this topic. You could sort of do both sides of this interview with your research too. But yeah, I think that, you know, there's a couple of things with orthopedics, like you said, whenever you start to review physicians or have like patient satisfaction scores and other things like that come to play, it affects the way you deliver medicine. And that's sort of what you're alluding to is, well, if a patient reports increased pain, then the physician's going to be inclined to give them more medication so that they get, better scores or evaluations. So that can be tricky. I would say nowadays, orthopedic surgeons are coming a lot more around the corner, especially where I work. They really sort of are being very mindful of this. They're actually doing some video education. So sometimes when someone gets signed up, let's say for like a smaller surgery in the grand scheme of things, like carpal tunnel release, for example, they'll actually have them watch a video, some of the surgeons, about the harms of opioids and why you want to minimize your use and just use as much as you need. But to understand getting off sooner is better. And little tweaks like that have made a difference. I do a lot of research on that. So I think they're evolving too, like dentistry, has evolved too, and sort of recognizing that they don't want to be a part of the bigger problem our country has. In terms of myths, I mean, I think there's a lot of myths about pain and, orthopedic pain and what helps. So unfortunately, when you go see an orthopedist or even a general physician, you don't usually get a prescription for nutrition, right? Like you come in with pain, knee pain or back pain, and they don't say, well, here, this is the diet I want you to take. This is a mindfulness activity I want you to work on. This is a stress reduction piece. This is a sleep piece. They just say, here's the medicine, here's therapy. And it, usually gets left at that. Sometimes there might be a shot, possibly discussion of surgery if that's indicated. But this whole piece of all this lifestyle factors that actually feed inflammation that often gets overlooked. And I don't think it's anyone's fault. I'm not trying to say it's a patient's fault or a physician's fault. I think one is a time crunch, right? So practicing physicians were under tremendous pressure to see multiple patients very quickly, and keep going, 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 going. And so it takes a little more time sometimes to talk about some of these things. They're not as quick. But I think there's things physicians can do. I think we can have handouts. I think we can have other staff members like dietitians or even medical assistants who can fill in the role a little bit. I think it's important though that it starts with a physician mentioning it at least because it carries some weight. So if your physician says this is important, and if you're a physician and you say that to your patient that nutrition matters and it affects your outcome, and then someone else gives a handout or someone else has a discussion, I think that's sort of like a nice way to not take up a lot of time but still get the message across. And it kind of goes back to the idea of like, for example, knee arthritis. There's always arthritis in the knee. Like once you have that diagnosis, you get an X-ray. The arthritis is always going to be there, but it doesn't always hurt. And it's not always swollen. It's not always inflamed. So right, so it's the inflammation that really drives a lot of the pain. So we can take a step back and look at ways to reduce inflammation, and hopefully we can reduce pain and pain medication use down the road.
Well, thank you so much too. And I was thinking, when I was doing the opioid studies, it was our country and New Zealand that were really high. So I'm just thinking this will take like a whole cultural shift because our culture is hungry for that quick fix, which
Mhm.
often leads to long-term detriment. And so your solutions may take longer and people might want that acute solution, but in the long term, it's best to really integrate a lifestyle shift. And I'm recalling too, when you say anti-inflammatory, we think of the NSAIDs and like ibuprofen, and people say, "Oh, I'll just take that." And I remember that the orthopedic surgeon said that there was a smaller study that said it impacted bone healing. And then in the military, people were popping NSAIDs like crazy. So they're having kidney problems, especially when they're dehydrated or you have GI distress. So just thinking in our very pill heavy society, like what can we do that is, yeah, it might take more investment of changes in our everyday life,
Mhm.
but the outcome is much more significant. And in your book, do you have kind of a rundown or what type of information do you have for those lifestyle changes?
Sure. Yeah, and I think that's a really good point. And I think it's important to back up and say, if you're having acute pain, you just had, a liver transplant, you just had, major spinal surgery, that sometimes there's a role, right, for medications in the short term. So I think that I just want to be clear. I'm not saying that, if you're having major surgery that you don't take a pain medicine, whether, like you said, that's an NSAID or narcotic type, whatever type of pain medication. So I'm not saying never, but I'm saying if we can build this layer, like you were talking about with the lifestyle beforehand, even. So before you even have that, and that's part of why the book says prevent too. It's like if you already build this pain resilience and you already have a lower level of inflammation going into a trauma, it's actually called prehabilitation. So we heard of like rehab, there's prehab,
I
right?
like it. Mhm.
Yeah, so you can prehab yourself, and so you can be able to be starting at a better starting point than the next person. So when you have an insult, which could be a trauma, which could be a surgery, you can bounce back easier. And so that's one way. So even starting today, people who are listening who don't have any pain issues, they're blessed with that. They can start to do some of these changes so that when that occurs, they do better with it and hopefully need less medication. And some of the lifestyle things we go over in the book, it's really there's actually like a fivefold program I came up with, and people like acronyms and they like things that sound cute. So it's called the Relief 5R, and
Awesome.
it's about refuel, which is nutrition, revitalize, which is exercise, recharge, which is sleep, refresh, which is about stress and mindset, and relate, which is about supportive relationships. And so it's sort of in that framework, the chapters are broken up. And at the end of each chapter, there's very little easy, actionable steps people can take to try to feel better and reduce inflammation.
That is awesome. And I was just thinking, gosh, I'm a marathoner. I'm like, that's marathoning 101 and how to actually function well and reduce, and I'm thinking too, like in our society, we think our pain needs to be zero. But people that are born without pain receptors can experience a lot of damage because they're not able to say, like, that's the siren that's saying something's not right here.
Mm.
So I imagine what you're bringing to the table is we're really tuning into our body and modifying. Like right now, I'm noticing, oh, I'm bending over. Well, my back hurts a little bit. Oh, my ergonomics are real poor.
Right.
Well, that makes sense, right? I'm like, you're going to only change the way I'm sitting.
Mhm. That's
Mm.
so true, and it's about, like, listening to your body like you are, like, if you ignore that and just say, "Well, I'm just gonna stay in the same position because 'cause I'm doing this, interview right now, and I have to do this," then you're gonna pay for that later, right? So, like, if you suppress these pain signals, like you said, they're communications or signals that something's going on, it's just gonna magnify and it's gonna come up amplified later, or it's gonna present in a different way, and that could be physically or mentally or emotionally too. It can come up in a negative way. So really listening to your body and being aware of those signals makes a difference. And I think it's really stepping back and saying like, what little tweaks can I make? And that's a big part of the book. Like, it's not about getting a personal trainer, and a yoga instructor that's private and a personal chef and all these things. And people who can do that, that's wonderful, and please do that. But if that's not realistic, then there's like really tiny little things we can do. I actually coined a term called micro boosts, which are just little steps that add up to big relief. And they're just tiny changes we can make in our day that can help us do better in the long run.
So if I were to come to you right now, and I'm like, oh man, I got really bad lower back pain, what would you recommend?
So I think, first we'd sort of take a good history, right? And a good exam. But we would go through in terms of integrative approach. I actually have patients who I see through my integrative center. It's like an 8-page intake, and it does go through their nutrition, their sleep, their activity level. It goes through stressors, it goes through things that bring them joy, it goes through things that they think can help them. So most people kind of know, like intuitively or from past experience, geez, I would feel better if. And it's kind of like getting the how. That's where I come in. It's like, well, how do you implement that into your day? So you feel better when you do X, let's say sleep 9 hours, just for example, but you don't make that happen. So how can we make that happen? You feel better when you walk, but you don't have 40 minutes to walk a day. Your schedule doesn't let you. Okay, so how can we do 4 10-minute walks? Where can we put them in your schedule? So it's sort of tweaks like that that I think make it easier and more realistic.
Yeah, that was so good. And I didn't mean to put you on the spot, but I was just thinking of back pain when I sit, and so much of our lifestyle has shifted. And even what you mentioned, often we have back to back to back meetings or patients. And what I struggled with as a resident was I was so used to exercising, and I had compartmentalized my workday and gym. Like this was kind of just a flaw in my mindset at that time. I'm like, man, if I would have learned to incorporate movement like many cultures do,
Mhm.
rather than say like it's all or nothing thinking, like how can we actually modify our day so that movement and appropriate ergonomics, especially physical in this standpoint, or psychological, as we'll go on to discuss how much stress and psychological influences can impact our pain perception. It's like that's what I would have recommended to residents at this time. How does that play into your everyday lifestyle?
So I definitely walk outside every day, and there's a lot of data about being outside specifically in terms of reducing inflammation, improving mood, and also kind of lining up with your circadian rhythm. So there's a whole school of thought about sort of syncing yourself to a natural circadian rhythm, going back to like our caveman, genes and ancestry, but kind of getting bright sunlight in the morning, okay, which helps set the melatonin peak that's going to have later that night. So you have to start out with getting bright sunlight. That's going to help the cortisol come down. That's going to help the melatonin rise 14 hours later and help have you a nice sort of ease into sleep. So, getting outside, moving, that's a big part of it. I think for me, the other thing has been not going to the gym. I don't go to the gym anymore. I used to before the pandemic, but then with the COVID, I stopped being a member of my gym. And I mean, it's a different kind of healthy, it's like a different kind of fit, but I just walk outside pretty much. I also have an elliptical that I can use if it's, like, rainy or whatnot, but I think we don't need to make it so formalized, like you're saying, like that black or white thinking, like, it only counts this exercise or this activity only counts if I was at the gym for an hour really sweating it out, and so you get to that maybe twice a week because your schedule only lets you do it twice a week, but you could walk every day, and you could walk 10 minutes at your lunch break, you could walk 10 minutes after work, like 10 minutes before work, and now you got 30 minutes in, and that's what the national guidelines are, is 30 minutes a day. So I think it's really doable, even for people who are residents. You could take the steps more, you could go the long way to the other office building. There's like little ways you can add it on, Of course, not if you're on like a 30-hour call, then you don't want to strain yourself, but on a normal day, I think there's little ways you can sort of tweak it to make it better.
And thank you for sharing that because I come from a family of power lifters,
Oh,
and you actually see a lot, especially if we're not lifting appropriately with appropriate form, then we
mhm,
can actually do more damage than good. And I think also I am a big anti-diet speaker, right? Because I think our culture, and it's the same thing when it comes to pain, we want that quick fix. So we often don't do the lifestyle changes that will often result in better outcomes for us. But when we think of the gym, people are talking about how can we kill it in the gym?
mhm,
And I was like that, like, and then it's just the stress on the mind and the body with that type of relationship with exercise over this past year. I've learned to improve my relationship with exercise, and I say that for anyone that's listening too. That's like when I think of exercise, I think I have to go crush it in the gym. I'm like, then you're exactly the type of person that might be ending up with some of this back pain, joint
mhm.
pain, muscle pain for sure.
Yeah, it's really interesting because I'm sure you've heard of the blue zones, and hopefully your listeners have too. But there are areas across the globe where people live longer and they have a healthier lifespan too. So they don't only live longer, but that years that they live, they have a longer health span where they are lived in good health. So it's a longer lifespan and a health span. And most of those people don't go to a gym, right? Like, that's not part of being in a blue zone. That's not like a requirement. It's that their everyday activities are physical. And so they get that movement in. And I think sometimes the word exercise is even taboo because it's kind of like it gives that mind of like the gym and like, sweating it out and competing with people who are next to you. So I think just calling it movement or activity, just adding more movement to your day. I think that's a nice way to say it. Even with people working from home, there's a whole thing. I gave a talk at Google about like the fake commute, and doing a fake commute in the morning and at the end of the day. That's a popular thing. Having a lunch plan. So it's not like you spend 2 hours figuring out lunch, like have a lunch plan like you did when you were going to work, which was pack, order. Google gets free lunch, so they have to make accommodation there. But having something in plan and then having transition times where you walk outside and you do walk the block or walk a couple blocks and you go from like work me to home me and you make that transition. And so it's like you said, it's sort of like a mental and physical because what's good for the mind is good for the body, and what's good for the body is good for the mind, kind of a thing.
I love that. And it was funny. I was thinking of a friend who works from home, and this was before COVID. And
Mm,
she said had to. She started working from home, and she would just say, "Oh, I could work in my pajamas," but
mm.
she mentally had to dress as if she was actually going into the office, and it changed the mindset and framework of how her day was more effective that way.
Oh,
And
that's really neat.
yeah, isn't it? I thought so
Mm,
too.
yeah.
I know we talked quite a bit about the ideas and the techniques to help prevent and relieve pain without opioids. Is there anything additional that you would think would be helpful for our listeners to understand about different techniques that might be more appropriate than opioids or the risk of opioids?
I think sort of looking at it is that there's more than medication. Even just asking your physician, or if you are a physician, thinking about that for your patients, you know, what other tools are there, and besides the opioids, and why does that matter? So, they say that 1 in 5 people can get hooked on opioids within a week. So some of the stats are really um, shocking and upsetting. So it's really something that if you have to use it, you really want to minimize your use of. You want to supplement it. So you could still give someone a prescription after a major surgery for a narcotic if that's indicated, but then also have the handout about sleep and about diet and about reducing inflammation, and about stress reduction and free mindfulness apps. Give them access to a website. Kaiser, for example, has a free website. You don't have to have a phone or anything. Just get on a computer and listen. You can give them a CD if they're older, and that's the technology's hard for them. So there's lots of workarounds. But I think just thinking of not one treatment and not putting all our eggs in one basket of the pills, but saying like, here's 5 other things, and they optimize even how the surgery works. Like there's better outcomes if you do these things. So, for example, we're talking about orthopedics, as I work in an orthopedic group, but the American Academy of Orthopedic Surgeons, AAOS, which is like their big academy, actually lists these factors in their surgical toolkit as things to optimize to have a better surgical outcome. So this is out there, it's evidence based. It's just a matter of trying to implement it into our practice and into our daily lives.
Yeah, and I think as we were mentioning, it's really a cultural shift. Like we have to be the leaders and say this is not, if if patients are relying on us to give
Mhm.
them the best advice we can give, we might assume patients may not be receptive of this information, but if we can help and show them that this is in their best interest, like it definitely, a lot of the things in our medicine need to change. And I love that you're in integrative medicine, because I think we can certainly bring a lot of that into our current, um, I guess, the mainstream medical approach to modify things to help improve. And I'm oral medicine trained, and we treat a lot of TMD, so temporal mandibular dysfunction or disorder. A lot of the pandemic and with COVID has increased that because of the stress. And I was curious to know what information you can share with the correlation of stress or even anxiety and maybe depression with the perception of pain.
So, like you alluded to, there's a huge connection. Stress, anxiety, even depressive symptoms, they all contribute to more inflammation, which can therefore feed more pain. So it's a pretty clear connection. We can get into the nitty gritty and talk about the sympathetic system and stress responses, and go right down to the molecules and IL-6 and, all these things if you want to really get into it. But the concept is, it increases inflammatory cytokines and messages in the body, having a lot of stress, feeling depressed and feeling anxious, like that all does that. And so really taking a step back and trying to address those stressors in your life. And we're not being unrealistic, right? We're not saying no one's going to have stress. You're not going to have, everyone has to work with difficult people, or maybe in your family have difficult people that you have to encounter. And it's kind of like, right, like how you handle that. And so, Andrew Weil, for example, he talks a lot about 4-7-8 breathing, which is a really simple practice of inhale for 4, hold for 7, exhale for 8. And there's a little more detail, but that's the general concept. And the idea is that that activates your parasympathetic system with a longer exhale, and that'll sort of counter some of that inflammation and stress response. So that's something nice to do. They say to do cycles of 4, do like one cycle of 4 before you're going to face someone difficult,
Mm.
or after you face someone difficult, or same thing before a meeting that is stressful, before talking with a child who stresses you out, a parent, whatever it is, have something in your toolkit that helps reduce stress. There's also something I talk about in the book called refresh anchors, and it's kind of like building like a little bag of things that bring you joy. So it could be like a picture of the beach, or like of a loved one or your dog.
Yeah.
Yeah, right. So having a little mini picture, a seashell, it could be a piece of chocolate. It could be something sensory too. So not just photographs. It could be like lip gloss, or like essential oil that brings you calmness. And same thing, before or after the stressor, go to that and reset and sort of calm down that whole stress reaction, instead of just letting it kind of cascade or sort of simmer. And then when someone says the wrong thing, you kind of snap, or kind of makes you feel more anxious, or you feel bad about it later, and it kind of feeds into that inflammation cycle.
Yeah, and it's so when you're saying like, what if it's our own internal dialogue that's the bully? And so, can you walk me through that breathing exercise? Because right when I asked the question, I was like, I was noticing I've been shallow breathing a lot with anxiety. I'm like, oh, breathing deeply would be so helpful. So, what can you remind me? What was the count?
Yeah, so I mean, it's 4 for the inhale, and you're supposed to have your tongue at the top of the bridge of your teeth, like right above where the soft part is, and then it's hold for 7 and exhale for 8. To do that 4 times. That's sort of like the classic yogic version that Dr. Weil, supports and teaches. But I mean, honestly, it's just a longer exhale. If you can even just start with that, if the 4-7-8 gets people caught up on like numbers and counting, like if that's counterproductive and like stresses you out. There's a Hindu one called Soham, which means I am. It's like I am one with the universe, kind of like I am. So it would be inhale, so, hold, and then exhale, hum. I have a variation of that in the books that's so calm. So it's the same idea. So just inhale, so, hold, calm, and just kind of like so calm, and just like kind of hold the calm and let it out. There's another one that I took a mindfulness course at Thomas Jefferson University Hospital, and they talk about a teenage sigh. And I just love that because you remember being a teenager, if you work with teenagers, if you have a teenager, there's a lot of drama, but they do this great exhale. And like it really helps even just do like the eye roll, and just to be like, just having like the
Yes,
whole, just
yes,
like is
yeah,
right. It feels
yes. even that laughter, there's laughter yoga. That's what it reminds me of, where you just really, and I shared with you, I have neuropathy real bad. It was one thing when I left dentistry, the drill, the vibration really exacerbated that. And I had so much anxiety and I would hold it. And I realized that would increase that neuropathy. And then learning the breath, like that, even when you had us walk through that first breath, I was like, whew, it really calmed you down. And it was, I realized the high anxiety, and for me, I live in an area it's very humid. Like I can feel that increases the pain, and just like that
Mm,
body awareness. First, when I didn't allow myself to experience and observe, I would get more anxious, and it would increase the pain.
mm,
So when you're relating these things, I'm like, yeah, I can certainly say that for real life experiences that I had to regulate my anxiety level to calm the body to reduce that pain. Otherwise, it's like it's a cycle because the neuropathy then drives your anxiety, that drives the neuropathy, that drives the anxiety. And you're like, oh gosh. So, of course, again, not medical advice, but personal lived experience of how beneficial it is to be in touch with your body and to regulate with that tool. Literally, that first deep breath that you had us do is like,
yeah. It's
very,
so nice and it's so easy, and that's what I mean about not time, not money. This is such like a little baby investment. But then let's say someone's listening to this, they learn that breathing exercise, and 2 weeks from now, they have a major injury and they need to have surgery in their arm. Well, guess what? While they're sitting in the ER, they can do this breath work while they're waiting. When they come out of the operating room, they can do this breath work. Like it's there. And if you just practice it ahead of time, then it's like in your toolbox and you can just call on it whenever you want, and it's just like a muscle, right? The more you use it, the more natural it is, the more easy it is. So if it's something you can even just do, like going to bed every night, do 4 counts of the 4, 7, 8, just so you know how to do it. And then when something happens, you'll be like, oh, this isn't weird. I'm not forcing it. This is my normal relaxation thing I do every night. I'm just going to do it now because this is like a sucky time. So I'm just going to do it now. You can just call on it then. That's what's so nice about it. And that's why, the book says, like you said, like relieving and preventing, because if you can be active in your prehab, and I think that can be really great. And it's funny because I actually, when I talk to patients sometimes who are preparing for orthopedic surgery, I'll use the analogy of the marathon. You said that you come from a marathon family, that no one just runs a marathon. Like everyone prepares for it. You shouldn't just go into a planned, there's emergent surgeries, but a planned surgery without preparing for it, without preparing your mind and body for it. And that's some of what this is about too.
yeah, I've definitely run a marathon without preparing, and it was not pretty. I cursed a lot at mile 6, but because I had run marathons before, so I kind of prepared. So it's like you have a baseline, and I thought I could do it because I've done so many before. And that was like the worst experience of my life. So I agree with you. I would advocate, and it made both the experience of the race and the after the recovery period. You risk injury.
Yeah.
I strongly advocate for people to truly train, and I probably should have just scratched that
Mhm.
marathon. And I also like that prehab. I was an oral surgery resident before I transferred to oral medicine. And prior to surgery, if they had orthognathic where they changed the jaw position, we would have the people try the elastics to help that would be stabilizing their surgery before they had surgery. Learn how to do it before, because after surgery, you're not going to be in the best mood. You're going to experience that pain. So if you are already conditioned, it makes the after so much better. And
Yeah.
then also to your point of, yes, there's a role for medication. Like I always think that 3 day period for oral surgery, it's like usually that pain, higher pain medications, we want it to be around that 3 days and then off or
Mhm.
taper. And I currently work for a cancer center, and of course they experience a lot of pain. That's a different cohort. That's a, you know, many times their pain management is necessary in order to keep their treatment going. And so, of course, it's like that's why we say you need to work with your medical provider. This is such great information, and there's relevance according to where you're at, and a role for medication depending on where you're at. And so, I really appreciate it. I am really looking forward to your book. I think it sounds fantastic, and I will make sure that the link is down below. Is there any additional thoughts or words of advice that you want to give the audience today?
I think with making changes just to make them really achievable and doable. So again, it's like we're talking about, it doesn't become a source of stress or something your inner critic or beat you up about, because we want it to be, if you're trying to say, look, I want to reduce inflammation, I want to change my diet for the better. I want to eat, for example, more vegetables. You can't just say I want to eat more vegetables because that's like this crazy lofty concept without any action steps in it. So you have to say every Thursday, my dinner plate will have half green veggies, or every dinner plate will have half vegetables. And then that's something that's achievable. You can see it, you can document it, you can track it, you can reward yourself when you do it, and you can feel good about yourself that you did something to help your body and mind. And so I think that's my big take home is, it's great to like want to get better and, build resilience and have less inflammation, but do it in tiny ways that are achievable and that don't set yourself up for failure.
Yeah, it's concept of that SMART goal.
Hmm.
Right? And I love that recommendation. And for the audience, of course, we'll have all of your links down below. When they get the book, if they get the book, of course, we'd love to hear the comments. They can reach out in our comments or reach out to you directly with questions. Thank you so much, Dr. Sharma, for being here. Thank you for your dedication to this really important topic. And thank you so much for the great resource.
Thank
And
you. And thank you for doing this and spreading the word to help people. It's really beautiful. Thank you.
thank you. And until next time.